Hello, my name is Gabrielle Nixon. I am a medical oncology nurse in the hospital setting in Wilmington, North Carolina. I recently participated in a collegiate debate on S5197, which is the Alternatives to Opioids in the Emergency Department Act. During this debate, there were lots of strong arguments made for ALTO. Some of these included the development of the implementation of alternative pain management and treatment plans will limit the use and the overprescribing of opioids in our emergency rooms across the nation. But also, with the use of alternative pain methods, we could possibly see a reduction in the amount of patients who enter into our emergency departments seeking opioids. But there were also valid points made against ALTO as well, and these included that the bill does not address addiction and treatment plans or options for patients. And the abrupt cessation of any narcotic or opioid could cause a patient to commit crimes, turn to the street for drugs, and even commit suicide to cope with their addiction. But also the cost of some of the alternative methods for helping and coping with pain could possibly or may cause a financial hardship for those who are suffering from pain if these alternative methods are not covered by insurance. I am pro alternatives to opioids in the Emergency Department Act. One of the reasons for that is between 1999 and 2015, we lost over 438,000 Americans to the opioid crisis. This is more than the amount of American soldiers that we lost in World War II. And that number was astounding as well. 416,000 American soldiers were lost in World War II. And we are still continuing to see our citizens dying from opioid crisis, and that number will probably increase. Our communities are trying to cope with this epidemic. In New Hanover County, our EMS and police officers carry Narcan and have made hundreds of saves in 2017 alone. Our hospitals are inundated with patients with chronic pain and substance abuse issues. Currently, we have 3 patients on our unit who have endocarditis secondary to substance abuse. This act will be the first line of defense to prevent the overuse of opioids. This act will also provide research that will help develop, implement, and enhance pain management in emergency rooms across the country. Nurses and physicians will require additional training on alternative methods to dealing with pain, but also educated on how to educate the public as well as the patients to different methods of dealing with pain. This bill will also and not only affect how emergency rooms use alternative methods for pain, but it will also trickle down into the units in hospitals with the fact that we will start using alternative methods first to help manage pain before offering opioids. This bill has passed in the House of Representatives and now is being reviewed by the Senate to be passed. I feel this bill should be moved forward and passed without delay. Currently, our country is in the biggest crisis our nation has ever seen. And currently, opioids are crippling our healthcare and our judicial systems. And according to the CDC, emergency physicians have a unique opportunity to engage in prevention of future overdoses, particularly patients who have not been seen or had any other contact with the healthcare system. Thank you.